My name's Elise Nichols. I'm the Speak Coalition Coordinator. So Speak is a local coalition working towards preventing youth substance use. And today I'm joined by Kassandra. Hello, Kassandra.
Hi, thank you for having me.
Can you introduce yourself?
I'm Kassandre Alexander. I'm the school health coordinator for the Clair County Health Department. I'm a public health nurse, and I'm the school nurse for Yale School District.
Thank you for being here, Kassandra.
Thank you.
So one of our kind of main focus areas in Speak is opioid use, amongst both adults and again amongst our youth. So can you describe what exactly are opioids for people who may not know?
They're derived from like a natural plant, a poppy plant that grows in nature. And they've been used for thousands and thousands of years primarily to treat pain. And essentially what they do is they activate part of our body called the opioid receptors. So we have some natural opioids or products that are derived from natural opioids like morphine, but we also have synthetic opioids, things like fentanyl, which are created in a laboratory to kind of mimic the effect of some of those natural opioids. And when we take them into the body, when they're used, they create a dulled sense of pain. And they're used to treat pain primarily. And they also can create a kind of euphoric feeling, that sort of floating, kind of pleasant feeling, which makes them one of the most common drugs of abuse for that reason.
Interesting. So, as you said, opioids can be used for pain. So if they are misused,
absolutely,
some of the effects they can have, short-term and long-term on your body.
So the short-term effects of opioids are probably the most concerning of them is the effect that they have on our body's breathing system. So opioids work on our brain. They work on our nervous system. They're a central nervous system depressant, similar to alcohol. They dull and kind of slow down the effect of our brain and our nervous system. So that's why they can make you feel kind of sleepy and a little bit tired, a little drowsy. Your reaction time is slowed. Your reflex time is slowed. But opioids specifically affect the respiratory center, which is the control center in our brain that has the control over our breathing. So when somebody uses opioids, especially if they use too many of them or use too high of a dose, it can slow the breathing rate down to a potentially deadly rate where the person just simply doesn't breathe enough. And this can cause their oxygen level to go to a fatal level. It's probably the most common reason why people die from a opioid overdose. And that can happen in somebody who has never, ever used opiates before, and it can happen in somebody who uses them chronically. In the long term, they can cause problems with the gastrointestinal system. They can cause chronic constipation. A lot of prescription opioid medications are combined with other drugs like acetaminophen or Tylenol. And if they're overused, they can cause severe and permanent liver damage. And they can also very quickly, within a very short period of time, cause physical dependence, which means that if the person suddenly stops taking those opioids, they can have a pretty severe withdrawal syndrome where they have shaking, chills, sweating, extreme irritation and anxiety, that feeling of electrical sensation going through their body, severe cravings, and that can happen with even short-term use of opiates.
And so, and I've heard different teens and youth say this to me before, but doctors can prescribe opioids, so there's sometimes this false sense of security that they're safe.
Yeah.
And so we've heard those stories of where maybe like a high school athlete or somebody had an injury and then was prescribed these, opioids.
Wisdom teeth.
yeah, and
Mhm.
became addicted. So,
Yeah.
some folks are wondering kind of what's the line there, like how do you kind of know um, the line between use from prescribed from a doctor and kind of addiction?
Yeah, the line between use and misuse, right? So it can be a very blurry line, especially for the person who's dealing with it. The disease of addiction can cloud a person's ability to recognize those symptoms in themselves. So one of the things that they can look for is, have they gotten any comments or concerns, expressions of concern from their loved ones or their friends about their use? That's one of the first major signs that there might be a problem, is somebody saying, worried about how much medicine you're taking. I'm worried about the way you behave when you're on these substances. Another thing to look at is, most prescription medications for opiates are prescribed to be used for a short period of time and only as needed. And so opioids are generally not very effective when they are used. A lot of research has shown they're really not effective used long term. They're best used in very, very short periods of time, like someone who has had surgery or who has some kind of an acute injury. So if somebody is using these medications longer than they're supposed to when they're being prescribed for them, if they're using more of the medication than being prescribed, if they are going to extremes such as lying or stealing to try to get more of the medication, mixing the medication with other substances like alcohol or other prescription medications in an effort to get high, those are all signs that there could be a problem. We also have to think about the physical dependence that the body gets on opiates. So if somebody has to stop suddenly to take their medication, they run out of their opiate and they start to feel very sick, then that can be a sign that their body is dependent on those opiates and they may need professional help in coming off of them.
So, um, and I know that we have systems in place here in St. Clair County, but you said as needed, you take your opioids if you are prescribed them by a doctor with some teeth or maybe an injury that you had.
Sure.
Um, and so if you had extra, how do we properly dispose of those so that nobody,
Great question.
yeah.
Yeah. Yeah. In fact, when we look at opiate misuse in adolescents in particular, the most common place that adolescents get opiate medication, painkillers like Norco or Percocet, is not that they're prescribed those medications from a doctor, although that does happen sometimes, like we said, with an injury or wisdom teeth or a surgery. They often find them or steal them from loved ones. Maybe grandma has them in her house, or maybe mom or dad or another relative or a friend of a family had surgery and didn't really take all their medicine. So they just keep them in the cupboard, maybe thinking they'll, get rid of them later. And the young person finds them and starts using them. It's really important that if you have opiate medication or controlled substances of any kind in your home and you are not using them, that they be disposed of properly. Do not just throw them in the trash. Do not just flush them down the toilet. You want to take them to a pharmacy or to the St. Clair County Sheriff's Department and dispose of them properly. A lot of pharmacies, including the Myers pharmacies, have just boxes, like drop boxes in the pharmacy area. They're kept locked and they have a one-way door that you can just put your medication in. If you want to peel the label off so no one knows it's yours, you certainly can do that, but you just throw the medication into this big metal box and it's disposed of through the pharmacy. That way you can feel assured that that those medicines aren't going to end up in the wrong hands.
Yeah, you're absolutely right. I think this is really enlightening, this conversation on opioids, because I know, as we talked about with vaping, this isn't just a St. Clair County issue.
No,
Is a Michigan issue. This is a United States issue. A lot of
it is.
people are dealing with these things. So I think it's important to talk about, and I'm glad that you will come with us today and walk us through some of these points. So again, thank you to Kassandra. If we have any questions, or if you have any questions, please drop them down in the comments below, or you can DM us on Instagram or comment on YouTube. We'd love to hear from you. But thank you, and we'll see you next time.
Thank you. Thanks.